Hi, my name is Greg Fell, Director of Public Health. This is today's COVID report, the 30th of November. A story in two halves. Firstly, the sort of general situation, largely as it was last week. We're definitely on the downward slope of the wave that we've seen. Quite high rates of COVID, sort of less than 300 per 100,000 and going downwards, and kind of will go up and down over a period, I think. Hospitalisations are downwards. They will go down really slowly, all up, and I've said it many times, we're in for a very, very, very difficult winter. We know what to do. Flu season hasn't yet started, but it will start soon. Most importantly, get your flu jab. If you haven't yet been vaccinated against COVID, then it's never ever too late. Don't feel that we've missed you because there's a vaccine there with your name on it. And all of the usual stuff, face coverings, and if you have symptoms, stay at home. If you regularly lateral flow device test yourself, all of those things are as they were. And be kind to your NHS and social care. They're working exceptionally hard to provide you with a good service, but it's pretty tough for them. So be kind, be patient, and think, do you really need to use healthcare services? That's the first half. The second half is Omicron. So this is a story that broke over the weekend. Variants of concern were always one of my critical concerns, always had the potential to set us back, and always been one of those points where the pandemic can flip quickly, and has done on a number of occasions, and this could be, we don't yet know whether it will be, one of those occasions. The concerns are multiple-fold, but there are as yet unanswered questions on whether or not it is more transmissible than Delta, whether or not it leads to more harm, more hospitalisation than Delta, and importantly, whether or not it leads to a less effective vaccination. Currently, the vaccination, the vaccinations that we use against Delta, they've achieved levels of effectiveness that we can only dream of. So there's a concern on account of the way that the Omicron variant has mutated and the nature of the mutations, that the vaccination may be less effective. We don't know that yet. And it's fair to say one of the critical issues is the extent to which this plays out in a well-vaccinated population, as is in the UK. It is in the UK. It's only a matter of time before it reaches South Yorkshire and then Sheffield. But it is in the UK. So accordingly, our strategy is to delay the spread as much as we possibly can. Face coverings, regular lateral flow device testing, keeping your distance. Do you really need to go out? Do you really need to have that thing face to face? Can it be done online? And importantly, isolate if you have symptoms and then get a test and act accordingly. So all of that is a delay tactic, and the delay is to buy time to maximise the booster coverage, and if you haven't yet had dose 1 and dose 2, maximise your primary dose, because even if there is immune escape, all of the indications are that the vaccines will still protect you against serious illness. We don't know that. We have to wait till the science is clear on that. But the most important thing that any of us can do is to get first 2 doses, and many of us have had them, most of us have had them now, and get the booster when you become eligible. And that's the thing that will still continue to contain the virus, and hopefully we see the end of the pandemic. Some uncertainties as the science on this develops over the next couple of weeks. I'll keep you posted as that does develop. But most importantly, get vaccinated against COVID and get the booster. So, changes in rules and restrictions as from today. So from today, face coverings have become mandatory. Again, in the number of locations, including shops, shopping centres, post offices, banks, hairdressers, as well as on public transport. Lots of people say to me, oh, that's a restriction. I'm not sure what it restricts us from doing. It's an intervention that has definitively reduced COVID transmission and has definitively protected people from harm, and arguably it's an intervention that keeps transmission lower and prevents proper restrictions. So I encourage all of us to do that, and just looking at public transport today, lots of people have started wearing face coverings again, so thank you for that. Other changes today will affect people arriving to the UK from abroad. They'll now have to take a PCR test and self-isolate until they receive a negative result from that PCR test. And another change which has come into effect today requires all contacts of suspected Omicron cases to self-isolate for 10 days, even if they're fully vaccinated. That's a temporary measure. It will be reviewed in a few weeks' time, and you will know if you have a Omicron diagnosis or an Omicron positive. Vaccination program is continuing to operate. It operates very successfully. So again, announced yesterday that all adults would be offered boosters, and by all adults, everyone aged over 18. There've been quite a lot of confusion about this, how it will work and how people can book. We were expecting more details later from the NHS on how that will work and how that will be accelerated to combat the variants. Boosters will be given in priority order, and we're focusing on vaccinating those that are most likely to come to serious illness, so the very old first, and then we work down the age cohorts. So all that said, as of last week, 22nd of November, 383,000 people in Sheffield had both doses of the COVID vaccination, and more than 102,000 had received their booster jab, which is a fabulous start, but it still means we've got a long way to go. So please do book your first and second doses if you haven't yet had them. That is the most important thing to do, and booster doses. 16 and 17-year-olds can now book their second vaccination on the National Booking Service. Walk-ins 12 weeks after the first vaccination are available, so you don't need to book, you can walk in. For 12 and 15-year-olds, there are additional clinics for 12 to 15s. Slots are released weekly, and again, you can book them on the National Booking Service for the Sheffield Vaccination Centre. Please be patient, please keep trying. Children can pop along without an appointment to one of the drop-in clinics this December. They're being run at Sheffield Children's Hospital outpatients, 7th of December and 13th of December. The Sharrow Community Forum on the 9th of December and the 15th of December, both 4 till 8. Lastly, please note, if your child has tested positive for COVID-19, they need to wait 12 weeks before they can have a COVID-19 vaccination, and that's on account of the JCVI recommendation from 15th of November.